Hello, everyone. Last time you finished the study of the effects of atropine. Atropine has very low selectivity to subtype of AMP receptors. It also has very low selectivity to the organ tissues. So the effects of atropine include it has inhibition effect on the gland secretion. On the eyes, it leads to mydriasis, increased intraocular pressure, and cycloplegia. It also neglects the visceral smooth muscle. Act on the heart, it can relieve the inhibition of vagal nerve. When it is in relatively high dose, it also can dilate the blood vessels, especially cutaneous vasodilation. It also improves the microcirculation. Act on the CNS. It has a stimulant effect. Of course, when the dose is large enough, it also leads to coma, even dies. Based on this effect, actually, atropine, it can be used to many diseases or conditions. So, including this, also include 6 points: antispasmodic, anti-secretory, ophthalmic uses, treatment for bradyarrhythmias, treatment for infectious shock, work as an antidote for cholinergic agonist, or treatment for organophosphate or mushroom poisoning. Okay, let me teach you one by one in detail. The first one, it can be used to treat intestinal colic and abdominal cramps, including bladder irritating symptoms. Compared with the other muscarinic antagonists, it is almost the most potent agent available as an antispasmodic agent, especially when the patient has this problem. It works as a competitive AMP receptor antagonist. This effect is more obvious. But actually, for the biliary and the renal colic, only use this AMP receptor antagonist atropine. It is not enough. Usually, we use atropine in combination with an opioid drug, like morphine, because they also has analgesic effect. But only use this antispasmodic agent like morphine to relax the smooth muscle. It is not enough to relieve this pain. Based on the inhibition of gland secretion, atropine is also used for pre-anesthetic injection because some anesthetics, especially some general anesthetics, has irritation for the gland secretion. Maybe after using the general anesthetics, these glands, especially glands in the respiratory system, upper or lower respiratory system, or trachea, secretion may be increased, so it can induce optical effect on the airway. So try to prevent a marked increase in IV secretion by irritant anesthetics by using atropine. These inhibitors of gland secretion. So it can help the patients to avoid causing aspiration pneumonia. But don't forget, some operation, especially at the abdominal part or gentle urinary tract operation. After operation, the function of the gut often requires a relatively longer period to recover. Sometimes, maybe because relaxation of smooth muscle effect by atropine, it will make this period prolonged. So, on the other hand, urinary retention and intestinal hypomotility following surgery could be significantly exacerbated by the use of antimuscarinic drug. So try to avoid that. This effect, inhibition of gland secretion, it also can be used to treat severe night sweat or salivation to inhibit sweating or salivary gland secretion. This is also helpful. And you know, atropine acts on eyes. It can induce mydriasis. It also make the ciliary muscle relaxed. So for the eye accommodation, it loses ability to accommodate. So it is very useful in ophthalmology. It can be used to prevent adherent formation in uveitis and iritis. Remember, when I taught you pilocarpine, I mentioned this. The second clinical uses of pilocarpine is inflammation of iris. Yes, it's same as is iritis. Try to avoid adherent formation caused by this inflammation in the local area of the eye. So we just use mydriatics like atropine or other M receptor blockers. And in combination with pilocarpine, M receptor agonists, use them together. Try to make the iris the smooth muscle movement. Understand? So it can prevent adherent formation in the inflammation. It is used for accurate measurement of refractive error. Because of ciliary muscle, it is relaxed by this drug. So lose ability to accommodate for the eye. And ophthalmoscopic examination of the retina optical surface, because of mydriasis, for this examination, it is much easier. But because this effect on the eyes caused by atropine, its duration is really long. It's almost lasts for 2 weeks. So actually, it is not a good agent for use this in the use of this examination. Understand? So for adults and older children, the shorter acting drugs are preferred. Later I will introduce them. But only for very young children, because their ciliary muscle function is really strong. Just use atropine, it is enough. But other shorter acting drugs, their function to induce this ciliary muscle relaxation, it is not enough. So only for adults and older children prefer the shorter acting drugs. For young children, just use atropine. But of course, because of mydriasis, this effect also lasts for several days. So after using atropine, try to suggest young children to wear sunglasses when they go outside. Yeah. Act on the heart, at the therapeutic dose, atropine often induces heart rate increased. increase heart rate. It also increase the AV conduction. So this atropine can be used to treat bradycardia and AV conduction blockade due to increased vagal tone. Actually, you will study a chapter anti-arrhythmic drugs, but in that chapter you don't study drugs for bradycardia or AV blockade, but you will study two drugs used for these two kinds of bradyarrhythmias. One is atropine, another one is isoprene. Now, next week I will teach you that. This is atropine. It is partially when this bradyarrhythmias, it is related to increase the vagal tone. Atropine is better than isoprene at these conditions. Treatment for infectious shock. Infectious shock. This shock, it usually caused by some infection of bacteria or virus. So usually the blood vessels in the body, it has appeared the blood vessels in spasm. Arteriolar spasm had this period. During this period, because of arteriolar spasm, some tissues will have ischemia. So at these conditions, we try to use atropine to improve the macrocirculation, because in relatively high dose of atropine, it can induce vasodilation. But don't forget, the patients with infection caused by bacteria or virus, sometimes the patients will have fever. This is a common symptoms when some patients have infection, and at the same time, heart rate also can increase. When the patients have fever, heart rate increase is so common. So this atropine in relatively higher dose, it also increase heart rate. So at that conditions, do not use it. You can choose others vasodilators. You will study in the following chapters. Atropine work as antidotes for cholinergic agonists. You have studied organophosphative compounds. Actually, for our body, these substances are toxic. So once someone has organophosphate poisoning, atropine is really important to correct the M signs. Did you remember? We should use atropine as early as we can. We should use this drug repeated, full dose. Try to achieve atropinization. Remember that? In the treatment of organophosphate poisoning. And some mushrooms also are toxic. Mushrooms are toxic because they contain muscarine. It can overactivate iron receptor, induce iron signs like organophosphate poisoning. So at that conditions, atropine, it also is very important to correct iron signs. Exercise acetylcholine or exercise physostigmine. Remember this drug? This is similar to neostigmine. They are inhibitor of cholinesterase because they can decrease the inactivation of acetylcholine. Then acetylcholine, it will accumulate in the body, so overactivate IM and N receptor, induce some symptoms similar to organophosphate poisoning. Remember that? At these conditions, The symptoms related to M receptor all can be corrected by atropine. So these three conditions, poisoning, you should think of atropine. It's very useful. Okay, now you finished studying the clinical uses of atropine. There are so many, but actually, most of them only work as a specific antidote for some poisoning. This atropine cannot be replaced by some other agents. But these conditions usually don't use atropine. You can choose other drugs with relatively higher selectivity. Now, I use this table. I hope it can help you to remember the effects and uses of atropine. You can set a relationship 1-to-1. It means act on glance. It has inhibit effect, maybe used for pre-anesthetic injection or used to treat night sweat salivation. Act on eyes because blockade of M receptor is also similar to negative effect on the eyes. Induce 3 response. It ices, increase the intraocular pressure, and cycloplegia. It is very useful in ophthalmology, used for respiratory error, matter of retina, like that. Act on smooth muscle. We also can consider it as a negative effect because of relaxation. This result. So used to relieve smooth muscle from spasm. Act on the heart because it can increase heart rate. So we can consider this is a stimulant effect. It can be used to treat bradyarrhythmias like bradycardia or AV blockade. Act on blood vessels. We also can consider this as a negative effect because it induces vasodilation. So, it caused by a relatively higher dose of atropine. Its significance is used as anti-shock agent in infectious shock, not other shock. Okay, especially novel days. So for effects and uses, there are 6 points. I hope you remember this together. Okay? Okay. That's all for this section. So just now, atropine has so many pharmacological effects and curative effects. At the same time, don't forget, this drug must have many adverse effects. So what are they? And just now, I also mentioned many conditions. We can use other drugs, not atropine, to treat. So what are the substitutes of atropine? Let's go on study adverse reactions and the toxicity of atropine. Atropine has so many effects. When some effects work as curative effects, other effects should be adverse reactions. So the common adverse reactions include dryness of mouth, inhibition of the glance secretion, blurring of near vision. It has blockade M receptor in the eyes, induce mydriatic and cerebral muscle relax, cycloplegia. Act on the heart, induce increased heart rate, so maybe even tachycardia. Erubescence. Remember this word? Erubescence means flush especially in face and neck. Cutaneous vasodilation caused by atropine in relatively higher dose. We use atropine overdose. It induces rapid and weak pulse, and even hot and flushed skin. Cutaneous vasodilation is more obvious. It also has obvious stimulant effect on seeing eyes. The patients will show restlessness, even agitation, hallucination, even coma. Once this drug used to, overdose, even due to toxic result. This is almost a toxic result. And once the patient has this atropine intoxication, the management usually are symptomatic treatment, and the specific antidote is physostigmine. Yes, as this condition should administer the physostigmine intravenously, and sometimes it also is requires to repeated administration. This drug, it is cholinesterase inhibitor. Remember this? It can slow the inactivation of acetylcholine, so induce the acetylcholine, endogenic acetylcholine neurotransmitter cumulative in the synaptic tract. So it can activate, bind to M receptor, compete to bind to the M receptor. You don't forget, actually, it is competitive antagonist of M receptor. So physostigmine can increase the concentration of acetylcholine. So acetylcholine compete to bind to the M receptor with atropine. So the effect caused by atropine can be antagonized by physostigmine. This is the reason why it is the specific antidote for atropine intoxication. Contraindications. When I introduced the pharmacoeffects of atropine, I mentioned this. One is glaucoma, because atropine can increase intraocular pressure. So especially angle closure glaucoma, don't use atropine. The patients with prostatic hyperplasia, especially in elderly men, antimuscarinic drug should be always used with caution. Don't make the urination more difficult by atropine. Now, this is two contraindications for atropine. Remember this. Okay, just now I mentioned many conditions and disease. We don't use atropine. We have many others. M receptor blockers can replace atropine. Now, some M receptor blockers also are from plants, like this one, scopolamine. Scopolamine, it is distilled from poison tobacco. It has the same peripheral action as atropine. In the peripheral tissue, the effects are same as atropine, but different on seeing eyes. On seeing eyes, you have studied atropine mainly induces a stimulant effect, but scopolamine has an inhibition effect on the seeing eyes. The patients will show the symptoms like drowsiness, amnesia, fatigue, dreamless sleep with a decrease in rapid eye movement sleep, even euphoria. But at relatively higher dose, it also produces excitement. So this special effect on the seeing eyes, inhibition, it is very useful. It is usually used to prevent or reverse motion sickness. M receptor blockers in the seeing eyes It is useful for this motion sickness. And the pre-anesthetic medication, this drug, it also can block M receptor in glands, inhibit the gland secretion, and at the same time, it also has inhibitive effect on CNS. It also is very useful for anesthetic. Has inhibitive effect, Used to treat Parkinsonism, it also is very useful because this is M receptor antagonist. For the patients with Parkinson's disease, the drugs include two families. One is dopaminergic agonist. One is M receptor antagonist. One day I will teach you that. This is a scopolamine. Anisolamine. This also distilled from plants, but its blockade of M receptor is relatively weaker than atropine. It has relatively higher selectivity for vascular spasm than atropine. So the main indications is to treat infectious shock and visceral smooth muscle colic. So compared with atropine, anisolamine used for these conditions, it has relatively less adverse effects. Synthetic and semi-synthetic substitutes for belladonna alkaloids. These are synthetic agents. Compared with atropine, they all have relatively higher selectivity or some other advantages. For example, like this, ipratropium bromide. This drug selectively acts on the bronchi, induce bronchodilation. So used to treat chronic obstructive pulmonary disease. It is useful. One day you will study the drugs used for asthma. In that chapter, you will study this drug again. Topicamide or homatropine or cyclopentolate. Because this drug has relatively shorter effect on the eyes, has a shorter duration of mydriasis than atropine. So these are very useful in ophthalmology, useful ophthalmological examination because they has relatively shorter duration of mydriasis. Benzotropine and trihexyphenidyl. These drugs mainly block M receptor in CNS, so they usually used to treat Parkinson's disease. When you study the drugs for PD, you will study this drug again. Darifenacin. This drug mainly relax the smooth muscle in bladder, so used for overactive bladder to relieve the symptoms of irritating bladder. Propancyline bromide. This drug has very higher selectivity to the GI tract. So it can decrease the secretion of the glands in GI tract. It also can relieve the smooth muscle of GI tract from spasm. Usually used to treat peptic ulcer and gastrointestinal spasm or ureteral spasm. It's very useful. So they have less adverse effects than atropine. Piranzapine and talonzapine. Both two agents can selectively bind to M1 receptor, so they can inhibit the secretion of gastric acid and pepsin. Just now, the clinical usage of atropine doesn't include peptic ulcer, but these two agents, the main indications is peptic ulcer because they have relatively higher selectivity to M1 receptor in stomach. But atropine, usually, this effect requires relatively high dose. So when use atropine has relatively high dose, there are so many adverse effects. Yeah. But these two agents induce relatively low incidence of dry mouth and blurred vision in therapeutic doses. Okay, that's all for this chapter. I also give you several questions. What are the pharmacological effects of atropine? What are the clinical uses of atropine? The major contraindications of atropines are, can you fill in this blank? Glaucoma and prostatic hyperplasia. What is the characteristics of anisotropic and scopolamine? This one has inhibiting effect on seeing eyes. It is a big difference from an atropine. Anisotropic has relatively higher selectivity to blood vessels, and the Sims muscle is okay. Till now, you studied M receptor agonist and antagonist. Now look at this figure. Try to compare these two drugs' effects on the eyes because they are opposite. And like pilocarpine or atropine or other M receptor blockers are very useful in ophthalmology, you know. So just use for different conditions of the eyes. Try to distinguish them. And of course, you can compare these two drugs and remember this. So here I want to explain about atropine. You know, it is the representative drug of M receptor antagonists. So I introduced this drug so detailed. But I just mentioned several other drugs, some specific characteristics. In the following chapter, many chapters, you will study many drugs. But you also, like this chapter, you also just mainly study one agent. But actually, like this atropine, in many conditions, we don't use atropine. We have so many substitutes. But why you mainly study atropine? Because it is the representative drug. It represents the every curative effects and adverse effects. And you know, with the development of medical science, there are more and more new drugs discovered or synthesized. So you just remember everything about the representative drug is enough. So other agents in this family, you just compare with this representative drug. Okay? So every chapter, the representative drug is the most important for you. Okay, remember when before I introduced the atropine, I mentioned a case about this food mistake. Due to mistaking Datura stramonium for oculus, the man and his families were poisoned. Actually, I let you guess what the result. What are the symptoms caused by this toxic substance? Actually this, not this. Now, I tell you, they became highly agitated and experienced visual hallucinations, and their examination showed dry skin and mucous membranes, absent bowel sounds and sinus tachycardia. Pupils are dilated and vision was blurred. Understand? I think you can understand absent bowel sounds because of motility of GI tract is inhibited by this substance, you know, atropine-like alkaloids. Yeah, actually, it's the same as atropine. And the plant remained, this materials was identified as the Datura stramonium. So it is exactly diagnosed. It is this substance, Datura stramonium poisoning. So the doctors took this measurement. Gastric lavage was performed, and activated charcoal was administered to remove any unabsorbed substance from GI tract. So here I want to ask you, what drug is a specific antidote to this condition? Remember? Tell me in classroom. Okay. I also show you two tables to help you review these chapters. Summary: drugs with anticholinergic actions. Okay. Now, just now you finished the study of N receptor antagonist. How about N receptor antagonist? What are their clinical uses? Go to study next chapter. Okay. Bye.